Welcome back to the deep dive. Today, we're tackling a subject that I know causes a lot of anxiety for cat parents. Feline lower urinary tract disease. You'll often hear it called FLUTD. Sounds a bit technical, maybe. But it's basically the term vets use for a whole range of issues affecting a cat's bladder and, the urethra, the tube urine passes through.
Yeah, and it's completely understandable why these urinary problems are so worrying. I mean, our cats are masters of hiding illness, right? So changes in their bathroom habits are often one of the first clues we get that something's not right.
Exactly.
So our aim today is really to sort of break down what FLUTD actually is, what might be going on underneath, and how it's typically managed.
Yeah.
Hopefully it'll help you feel a bit more informed, maybe a little less overwhelmed.
That's the plan. And while, any cat can get FLUTD, we do seem to see it more in certain groups, don't we?
We do. Often it's those middle-aged cats, perhaps the ones who are, shall we say, enjoying the indoor lifestyle, maybe carrying a few extra pounds, not quite as active.
Right. The couch potatoes.
Kind of. And interestingly, stress. Stress is a really big piece of the puzzle for many cats with these issues.
Which we'll definitely get into.
Yeah.
But the key takeaway, like with most health things, is catching signs early makes a huge difference.
Absolutely crucial. So what are we looking for? Well, the classic signs are things like straining when trying to pee, maybe crying out, or going to the litter box really frequently, but only passing tiny amounts.
That sounds painful.
It often is. You might also notice them starting to urinate outside the litter box, perhaps in strange places like on tile floors or in the bathtub.
Oh, yeah, I've heard of that.
And definitely look out for blood in the urine. That's a clear sign. Or if they're licking their genital area way more than usual. Those are definite red flags.
Okay, those seem pretty obvious. But what if your cat goes outside sometimes? It might be harder to spot those things. Are there, less obvious signs?
That's a really good point. You have to become a bit of a detective. Look for any changes in their normal routine or behavior. Is your cat suddenly less energetic? Hiding away more? Maybe they're drinking a lot more water than usual, or perhaps the opposite, they've gone off their food. Sometimes you might just notice a little damp patch or staining around their back end. It's about noticing those subtle shifts.
Right. Anything out of the ordinary for your cat.
Exactly. But there's one sign we absolutely have to stress because it's not just a worry, it's a genuine, life-threatening emergency.
Okay, this is important. What is it?
If your cat cannot urinate at all, if they are straining and straining and nothing is coming out, that is an emergency. Full stop. Get to a vet immediately.
Why is that so critical?
Because it means there's a complete blockage. Urine can't get out, so toxins build up incredibly fast in the bloodstream, electrolytes go haywire. It can be fatal within sometimes just 24 to 48 hours.
Wow, that fast.
Yes. Another emergency sign to watch for is if their abdomen, their tummy, feels really swollen and hard or painful when you gently touch it. That can also indicate a blockage. Immediate vet attention is needed.
Okay, message received. Inability to urinate equals emergency vet visit. So we know FLTD isn't one single disease. What are the common culprits behind these symptoms?
Right, it's like an umbrella term, as you said. Several different things can cause these signs. One common category is urinary stones. Vets call them urolith.
Like little pebbles.
Exactly like that. Tiny crystals or actual small stones can form in the bladder or sometimes get stuck in the urethra. They cause irritation, inflammation, and sometimes blockage. The two most common types we see are struvite and calcium oxalate.
And do they need different treatments?
They often do, yes. Struvite stones, for instance, can sometimes be dissolved with special diets because they tend to form in alkaline urine. Calcium oxalate stones, though, usually form in more acidic urine and typically need surgery. Diet's trickier there.
Interesting. Okay, so stones are one cause. What else?
Another issue, especially common in male cats, is something called a urethral plug.
A plug. What's that made of?
It's basically a mix of mucus, inflammatory cells, crystals, kind of like sludge, that forms and gets lodged in the urethra, blocking urine flow. Male cats are more prone just because their urethra is longer and narrower.
Anatomy plays a part.
It does, and sometimes it's not even a physical plug, but the muscle of the urethra itself goes into spasm and clamps down, causing a blockage that way too.
Okay, so stones, plugs, physical blockages. But I know there's another really common one, right? FIC.
Yes, Feline Idiopathic Cystitis, FIC. This is actually the most frequent diagnosis we end up with, especially in cats under 10 years old. Idiopathic just means we don't fully know the exact cause.
So it's a bit of a mystery.
It used to be more so. We now understand it's much more complex than just a bladder issue. It seems to involve an abnormal response to stress, affecting not just the urinary system, but the nervous system, the endocrine system. It's a whole body response, really.
Kind of like interstitial cystitis in people.
Very similar, yes. And that stress link is absolutely crucial with FIC.
What kind of things stress cats out enough to trigger this? I mean, they seem to sleep most of the day.
Well, cat stress can be subtle to us. Changes in routine are a big one. New feeding times, maybe you move the furniture. Conflict with other pets in the house is huge. A new baby, moving house, even boredom or lack of stimulation. All these things can increase the risk or trigger flare-ups of FIC.
Okay, that makes sense. So stones, plugs, FIC. Are there other possibilities under the FLUTD umbrella?
Yes, definitely. Bacterial urinary tract infections, or UTIs, can cause similar signs. Interestingly, though, they're less common in young, healthy cats than many people think.
Oh, like that.
Younger cats tend to have more concentrated urine, which is less hospitable to bacteria. We see UTIs more often in older cats, say over 10 years old, especially females, and often those who have other health issues like chronic kidney disease or diabetes, which can change their urine composition.
Okay, so UTIs are more of an older cat thing, potentially linked to other conditions.
Right.
Anything else?
Less commonly, you might have things like structural defects in the urinary tract, maybe something they were born with. Or they could develop strictures, that's a narrowing of the urethra, maybe from previous inflammation or injury.
Right.
Cancer of the bladder or urethra is possible, but thankfully it's quite rare. And then you have things like direct trauma or injury to the area, or even nerve problems, perhaps from a spinal issue that affect bladder control. But those are less frequent causes.
Gosh, it really is a wide range of possibilities presenting in a similar way.
Yeah.
So how does a vet figure out which one it is when a cat comes in showing these signs?
It starts with a really good chat. We need a thorough history. What exactly have you been seeing? When did it start? What's the cat's diet, water intake, litter box setup? Any recent changes or stresses in the household? That history is vital.
Gathering clues.
Exactly. Then comes a careful physical exam. We'll feel the cat's abdomen, paying close attention to the bladder, especially in male cats, checking if it feels large or painful, which could suggest a blockage.
And then, presumably, tests.
Oh yes, tests are key. A urinalysis is almost always done. We look at a urine sample under the microscope and run tests on it, checking concentration, pH, looking for crystals, blood cells, protein, signs of infection like bacteria.
How do you get the urine sample? Can owners collect it?
Sometimes a free catch sample collected at home works, but often, to get the cleanest, most reliable sample, especially if we suspect infection, the vet will collect it directly from the bladder using a fine needle. It's called cystocentesis. Sounds scary, but it's quick and generally very safe.
Okay. What else? Blood tests.
Yes, blood tests are really important, particularly if we suspect a blockage or if the cat is generally unwell. They tell us about kidney function, electrolyte levels, things that can go wrong quickly with urinary obstruction.
Makes sense. Any imaging involved, like x-rays?
Sometimes, yes. X-rays are good for seeing certain types of bladder stones. The dense ones show up well. An abdominal ultrasound can be even more informative sometimes. Ultrasound lets us see the bladder wall thickness, check for stones that maybe don't show on X-ray, look for masses or tumors, and assess the kidneys, too. It gives a really good look inside.
Right.
And if we see signs of infection on the urinalysis, or if we suspect a UTI based on the cat's history, we'll usually send a urine sample off for a bacterial culture and sensitivity test.
What does that tell you?
It confirms if bacteria are actually growing, identifies the specific type, and crucially tells us which antibiotics are likely to kill those bacteria, so we can choose the right drug.
Or treatment.
Exactly. But it's worth mentioning, sometimes even after all these tests, we don't find a specific single cause. And in those cases, especially if stress seems to be a factor, we often arrive at a diagnosis of Feline Idiopathic Cystitis, the FIC we talked about.
Okay, so the investigation can be quite thorough. Let's move on to treatment then. How do you approach treating FLUTD once you have an idea of the cause?
Well, as you'd expect, it really hinges on that underlying cause. If we find stones, for example, the approach depends on the stone type. Like we said, some Struvite stones might dissolve with a special prescription diet.
So food is medicine.
In that case, yes. But other stones, like calcium oxalate or Struvite stones that won't dissolve, usually require surgery to remove them. The good news is, often these surgeries can be done using minimally invasive techniques now.
That's good to hear. Now, what about those emergency blockages? You get the cat unblocked, then what?
Right. Unblocking is the absolute first priority. That involves stabilizing the cat, usually with intravenous fluids, pain relief, sometimes muscle relaxants. Then, typically under sedation or anesthesia, we pass a urinary catheter to flush the blockage out and reestablish urine flow.
And does the catheter stay in?
Often, yes, for a day or two. It helps keep the urethra open while the initial inflammation settles down and allows us to monitor urine output closely. We also need to watch kidney values carefully, as blockage can cause kidney injury.
Is surgery ever needed for blockages?
In rare cases, for cats that repeatedly block despite other management, there's a surgery called a perineal urethrostomy, or PU surgery. It basically creates a wider urinary opening, more like a female cat's anatomy, making future blockage much less likely. It's usually considered a last resort, though.
Okay, a significant step. What about treating UTIs?
That's more straightforward. Antibiotics are the main treatment, ideally based on those culture and sensitivity results we talked about, so we use the most effective drug for the right duration.
And things like structural problems.
Those often need surgical correction. For example, that PU surgery might also be used for urethral strictures, the narrowings we mentioned. Cancer treatment varies hugely depending on the type and stage, maybe chemotherapy, anti-inflammatories for comfort, or surgery for some tumors.
Which brings us back to FIC, the common one with no single fix. How do you manage that?
Yes, FIC. Since we can't target one specific cause, management is all about reducing the frequency and severity of the episodes, those flare-ups. And this is where that concept of multimodal environmental modification memo comes in.
MEMO. Right, tell us more about that. It sounds comprehensive.
It is. The core idea of MEMO is to change the cat's environment to increase their sense of security and control and decrease things that might be perceived as threats or stressors. It tackles things from multiple angles.
Okay, so what are the key components of MEMO?
Litter box management is number one, absolutely critical. You need enough boxes. The rule of thumb is 1 per cat plus 1 extra.
1 + 1. Got it.
They need to be in different locations, quiet spots where the cat feels safe. Scoop them. Daily cats hate dirty boxes. Most prefer large, open boxes, not covered ones. And unscented, clumping litter seems to be the favorite. Think about access, too. Especially for older cats, low sides might be needed. Poor litter box hygiene or setup is a major stressor.
That makes so much sense. What's next on the MEMO list?
Increasing water intake. This is huge for urinary health. More water dilutes the urine, which is generally a good thing.
How do you get a cat to drink more? They can be fussy.
They can. Switching to wet food is probably the single most effective way. You can also try water fountains. Many cats love moving water. Have multiple water bowls around the house. Maybe try different bowl types: ceramic, glass, metal. Keep the water fresh. You can even add a bit of water to their food.
Okay, water, litter boxes. What else?
Stress reduction is paramount, especially for FIC. Identify potential stressors. Is there conflict between cats? Are they bored? Has their routine changed? Try to minimize those things. Provide ample opportunity for play and mental stimulation. Create safe hiding spots or high perches where they can retreat and feel secure.
Like little cat caves.
Exactly, places they can own. Some people find pheromone diffusers like Feel Away helpful in creating a calmer atmosphere too.
And diet. You mentioned it for stones, but what about general FLUTD or FIC?
Well, besides specific stone-dissolving diets, just switching to wet food, as we said, helps with hydration. Some prescription urinary diets are designed to manage urinary health generally, maybe help reduce crystal formation or support bladder health, even for FIC. Your vet would advise if one is appropriate.
Any medications for FIs?
During an acute, painful flare-up, short-term pain relief is really important for comfort. For long-term management, sometimes vets might discuss things like gag replacer substances meant to support the bladder lining, though evidence is mixed. You've hit the nail on the head. It often requires a tailored approach and patience. And unfortunately, recurrence can be common, particularly with FIC. So prevention and long-term management are just as important as treating the acute episode.
So what are the key things owners can do proactively to support good urinary health and hopefully prevent future problems?
A lot of it comes back to those MEMO principles. Continue them long-term. Ensure plenty of safe resting places. Meet their sensory needs, scratching posts, climbing opportunities, window views. Always have fresh, clean water easily accessible. Maintain those pristine, well-placed litter boxes.
Keep the environment predictable.
Yes, consistency helps reduce stress. Daily play sessions are great for stress relief and weight management, too. Keeping them at a healthy weight is important. In multi-cat homes, providing separate resources, food, water, litter, rested spots for each cat is crucial to minimize conflict.
What about diet long-term? You mentioned specific diets for Struvite stones.
Right. If a cat has a history of Struvite stones, they might need to stay on a special diet long-term that restricts minerals like magnesium and keeps the urine slightly acidic. But this absolutely must be done under veterinary supervision because over-acidifying the urine can cause other problems, like promoting calcium oxalate stones. It's a balancing act.
So ongoing vet checks are important too.
Definitely. Especially for conditions like FIC, it's often about ongoing management, adjusting strategies as needed, working closely with your vet to find what works best for your individual cat. It can take time and effort.
It's definitely clear that FLUTD is, well, complex. Lots of potential causes, lots of different management strategies.
It really is. And that's why it's so crucial for everyone listening to understand that everything we've discussed today is meant to be educational. It's information. It is absolutely not a substitute for professional veterinary advice.
That's probably the most important point we can make. If you notice any of these signs or have any concerns about your cat's health, especially their urinary habits,
Please make an appointment with your veterinarian. They are the only ones qualified to examine your cat, run the necessary tests, figure out what's really going on, and recommend a specific treatment plan tailored just for them. That's fundamental for their well-being.
couldn't agree more. But it does sound like there's hope. With proper diagnosis, the right management plan, and attention to their environment and needs, many cats with FLUTD can go on to live happy, comfortable lives.
Absolutely. With careful management and that owner-vet partnership, the outlet is often very positive.
So maybe a final thought for our listeners. Just take a moment later to observe your cat. Think about their daily life, their environment. Are there any small tweaks, any little changes you could perhaps make that might just enhance their comfort, reduce a potential stressor, and contribute to their overall well-being?
That's a great takeaway. Sometimes those small adjustments can really make a surprising difference.